Thank you. Dr. Redd.
Chairman Johnson, Ranking Member Carper, and distinguished members of the committee. My name is Stephen Redd. I'm Director of the Office, as you've just heard, I'm Director of the Office of Public Health Preparedness and Response at CDC, and it's my pleasure to appear today to discuss the work CDC is doing to prepare and respond to threats to the health of the public. As you know, CDC works to protect the public's health by helping communities improve readiness and response. This is for chemical, biological, radiation emergencies, whether those are intentional, naturally occurring events like the Ebola epidemic or the Zika virus epidemic, or accidental. There are two key programs at CDC that enable us to prevent, detect, and respond to public health threats: the Public Health Emergency Preparedness Program and the Strategic National Stockpile. Both programs had their origins before September 11th and the anthrax attacks of 2001. They were greatly expanded after those events in recognition of the need to improve the ability of the public health system to respond in scale and in speed. The Public Health Emergency Preparedness Program's overall aim is to prepare the nation to respond to public health emergencies. Since 2002, $10 billion has been devoted to this effort. The program funds 62 awardees, all states, 4 large cities, and 8 territories. And what it actually funds are staff, epidemiologists, laboratory experts, risk communication experts, emergency operations centers, laboratory equipment, planning and exercising, and efforts to respond or to correct things that are identified in exercises and natural events. The Strategic National Stockpile is the national repository of life-saving medicines, vaccines, and medical supplies, such as mechanical ventilators. Currently, the stockpile holds over $7 billion in assets. It operates as part of the Public Health Emergency Medical Countermeasure Enterprise, which you've heard about. The stockpile procures, stores, and delivers supplies in times of emergencies. Both the Public Health Emergency Preparedness Program and the Strategic National Stockpile were instrumental in the Ebola response and are being used as part of the Zika response. So let me now turn to Zika. As of yesterday, 41 countries have reported local transmission of the Zika virus. In the continental United States, over 300 cases, travel-associated cases, have been reported. About 1 in 10 of these are in pregnant women. 7 have been sexually acquired through sexual transmission. There is currently no local transmission by mosquitoes, but the problem exists here because of these travel-associated cases and sexually transmitted cases. In Puerto Rico, there is transmission from mosquitoes. Over 300 cases, about 1 in 6 of these are in pregnant women. As you heard, just to talk about some of the things that we're doing in the Zika response, you heard from Senator Carper that yesterday CDC authored a publication that concluded that Zika virus infection causes severe birth defects. That article also identified a number of the outstanding scientific questions. On April 1st, we convened the Zika Action Plan Summit in Atlanta. This brought together state and local health officials to review the latest scientific information and to jumpstart planning at the state and local level. We also issued travel guidance for women who are pregnant within 72 hours of identifying the virus in the brains of children and fetuses that have died. We have developed laboratory tests. We're working closely with local health departments, and we're implementing mosquito control measures with the government of Puerto Rico to prevent transmission to pregnant women. Public health threats are ever present. Due to the investments from Congress, the nation is better prepared to prevent, detect, and respond to health emergencies than we were before the events of September 2001. And at CDC, we are on the front lines to protect Americans from health threats wherever those threats occur. From recent experience, we know that we'll be called upon to respond in the future. Thank you.
Thank you, Dr. Redd.